Hello and welcome to today's episode on life-saving aid. Today we are going to be looking at what to do for an adult who suddenly becomes unresponsive after losing lots of body water. It's important we note that one way an adult can lose significant amount of body water is through diarrhea, and one way an adult can have diarrhea is through food poisoning. Now it's important I stress at this point that food poisoning simply refers to the consumption of a contaminated food or water. And this contamination can be either by a virus, a bacteria, a parasite, or a harmful chemical. This is why it's important that before you eat anything out there, be sure of the environment under which this food is being prepared. What is the food hygiene level? What is the food safety level of what you're about to consume? Are there anything you are allergic to in that food? Because at times, you might just be allergic to certain ingredients in the food. And then when you consume it, you can start having diarrhea. Now, it's not all diarrhea that can make an adult become unresponsive. However, any form of diarrhea that leads to significant loss in body water. We are talking about diarrhea whereby the adult is having about 7, 10 and upward episodes of diarrhea. In such situation, that adult is at risk of developing cardiac arrest. Why? Because anything that leads to a significant depletion or reduction in body water can cause electrolyte imbalance, and this electrolyte imbalance can cause cardiac arrest. When an adult is having diarrhea, it's important we take the right steps to prevent this significant loss in body water. How do we do this? We can give fluids like rice water, coconut water, your salt, sugar solution. If you have access to ORS, great. You can prepare it and give. Don't say, oh, because this person, anything he eats, he stools. You say we are not going to give anything. You will be worsening the victim's condition. So it's important that we do the right thing in order to prevent this diarrhea from becoming worse. Please, when an adult is having diarrhea, multiple episodes in a day, please don't sit at home and try to treat yourself. Take your way to the hospital and let the cause of this diarrhea be quickly identified and proper treatment be given. But in the event whereby an adult who is having diarrhea, complaining about abdominal pain, at times there might be no pain, just repeated diarrhea, suddenly becomes unresponsive. This person will start complaining and feeling dizzy and feeling weak, and before you know, they become unresponsive. What do you do as the rescuer within that vicinity, or as the only person that is within that environment? Please don't run away or don't be quick to go and announce that this person is dead. Unfortunately, in our environment, we have situations whereby people have been pronounced dead even before they actually died. And because we don't know what to do and how to recognize when a victim is unresponsive, we end up allowing the person to die even when they could have been given a fighting chance at survival. And this is why this video is important. So how do we recognize when someone is unresponsive and not dead? Number one, you check, they are not breathing, they are appearing lifeless. Number two, you check for pulse, where at the junction between the lower part of the jaw and the neck, here, you press deep, you feel. Is there pulsation? Are you feeling anything hitting your finger? If there's nothing, it means that this victim is unresponsive. Please do not say this victim is dead. Do what we're about to show you while you make your way to the hospital or while you call emergency medical services. Now, you've ascertained that this victim is unresponsive, right? You lay the victim flat on their back on a firm surface. You tap, hello, can you hear me? Can you hear me? Hello, bro. Hello, madam, can you hear me? No response. You call for help. You call your emergency medical services, or you call for a means of transportation to the hospital. Call for help, someone that can be of help. While you are trying to do that, you clench your fist, you come to the lower part of the middle of the chest, in between the two nipples. Okay? This is the two nipples. The lower parts, which of the middle of the chest, that's where you apply chest compression. Depending on your relationship with the victim, if you are close enough with the victim to give rescue breath, you can go ahead to perform CPR that involves rescue breath. But if you are not comfortable with giving rescue breath, please give chest compression, and your aim is to give between 100 to 120 chest compression in every minute until emergency medical services arrive, until you get to the hospital. How do we do that? We'll come to the middle of the chest, we'll clench our fist like this, and then we'll place the heel of our hands on the chest, the middle, and you press deep. Don't be afraid of fracturing the rib cage. Most times this complication barely happens. So you press deep and fast. That way you can help give this victim a fighting chance. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62. You keep the chest compression going until you get to 100. Please and please, you must always count out loud so that whoever is within the vicinity can also help you in monitoring the progress of what you are doing for the victim. And when you get tired, call for help. Please, can someone else come and continue this chest compression? Remember, when someone becomes unresponsive and you are giving chest compression, what you are doing is that your hand automatically starts performing the function of the heart. What's the function of the heart? It pumps blood around the body. So if the heart stops suddenly, which is cardiac arrest, What you are doing by giving your chest compression is to start performing the function of the heart, whereby your hand is now what is pumping blood. And the heart rate, the average heart rate, is between 60 to 100 beats per minute. That's the average. And so that's why your target is between 100 to 120 chest compression every minute until emergency medical services arrive, until you get to the hospital. We've seen situations whereby people were unable to recognize that a victim that is having diarrhea is now having cardiac arrest. The confusion is usually there that, oh, he was just passing stool. Why should that affect his heart? Severe depletion in body water can lead to cardiac arrest. And that is why it is important that when someone is complaining of having repeated episode of diarrhea, please take it seriously. Get to the hospital as soon as you can for proper care to be given to that victim. But in the event whereby while this person is complaining and having this symptom suddenly becomes unresponsive, please do not pass the verdict that this victim is dead. Perform cardiopulmonary resuscitation until you get to the hospital. I hope this video helps someone out there. Share this video so that together we can help save more lives. Stay safe out there.